If you've ever had a problem with what's called costochondritis, big word that basically means this. It's also known as chest wall pain or costosternal syndrome. And I had a gentleman named Blake reach out to me today, and Blake reached out to me and he said, look, I've been having this problem. It's been going on for 8 months. I can't get any relief from anything. Can you please do a video to help me? So I thought, you know what, let me do this to help him, help you. And it was a good moment for us to kind of talk about this. Now look, just so we're on the same page, costochondritis is itis. Itis, anytime you hear somebody say itis, that means that it's inflammation. So in this particular case, it's inflammation of the cartilage of the rib coming into the sternum, right? So the rib connecting in here. So a lot of times we'll see it right in here in these areas, and a lot of times we'll see it on the same side as the heart. But whatever it is, it ends up causing problems as far as pain and tenderness, and it causes, when you try to take a deep breath, it's like increases the pain because that breathing ends up causing more pain and discomfort within there too, because it puts more pressure on that costosternal joint. So the rib and the joint of the sternum coming together, that expands what goes on. Now, treatment of that is basically defined by the Mayo Clinic. They say, look, you can use things like NSAIDs, you can use meds, you can actually do injections into the joint. So all these things for anti-inflammatory. I'll recommend for my patients too, I'll tell them ice tends to help with that too, because it is an itis. And like we said, anytime there's an itis, that means there's inflammation. And so if there's inflammation there, we want to decrease the inflammation. And if we can do that, 20 minutes of ice with a towel between the skin and the ice, do that 3 to 5 times a day for 3 to 5 days, and it typically will decrease that inflammation of the area. All right, I wanted to take a quick time out just to add in one more thing as something that you can do at home to help with this, and that's stretching this area too. Sometimes with the inflammation, you can do some light stretching that'll really help in there. So if you get into a door frame, take your hand, put it just above the height of your shoulder, and what you want to do is you want to bring your chest up and rotate away from it. If I've got a problem here, that's going to help stretch that area right in here too. Sometimes just everything being tight right there makes a big difference as far as opening that up. Sometimes not as high as the shoulder, sometimes you want to come down a little bit. And again, I'm taking my body and I'm rotating away from my hand that's working as like an anchor to keep me in position and stretch this area. One other one that you can do too is sometimes, because we get pain that's a little bit higher up with those ribs, is come up here and grab the top of the door frame or the top of something where you can kind of get up high and then lean into it. And as I lean into it, you'll feel it stretch all through here and then into the top part of these ribs too. If you've had problems lower in the ribs, you're gonna come lower down here and you can do the same kind of thing and turn that way. All of those will help stretch out the area within that too. So let's go back to more information about it. Now, having said that, usually costochondritis will resolve within days or weeks. Now, we have seen situations where it can last months and years. Incredibly painful whenever that happens. So if you're in a situation where you're dealing with something like that, that rib head pain, that costochondritis pain, that chest wall pain that's been going on for months or years and it just has not gone away, then this is something that you're going to want to think about. You're going to want to think about what's going on with the rib head. It's not supposed to be going on that long. Sometimes we'll get little shifts. So what happens is this, is that because of an injury, an impact, a trauma, or a sprain, strain, let's say you're lifting, you're working out, you move some things, you help somebody move, whatever it was, doing those kind of things can put strain on an area that it's not typically going to get strained, but it can, and then it can cause the inflammation of the joint that's within there. Another thing that can happen is that that rib head itself can get out of position. So think of it like this. The rib head comes in, right, in the front and the back, because it's a ring, comes in and connects into the sternum or in the back into the spine. And when it comes in like that, it attaches like this. So this is the rib head. When it comes in, what can happen sometimes is that rib head can slightly move out of position. When it moves out of position, the problem is that there's connective tissue all wrapped around that. So think of it like this. That connective tissue that's wrapped around it, it's all connected with pain fibers too. So unfortunately what happens is when that rib head shifts, think of it like saran wrap wrapping around it. Well, that saran wrap now stretches because I'm over exaggerating. But now what happens is that rib head, as it pulls on that saran wrap, what ends up happening is it causes a lot of pain. So the more you try to breathe and take a deep breath, or when you cough or you sneeze, it'll cause more pain in that area because that rib head is now out of position. Here's the thing. There is no amount of ice or NSAIDs or meds or injections or anything else that's going to get that rib head back into the place that it needs to be. So what you have to do is you have to find someone like a chiropractor that knows what they're doing, right? So in our office, we help people with this all the time. In fact, we get referrals from the ER all the time because a lot of times people feel that pain, that chest pain, and they'll think that they're having a heart attack. So we always say, look, go to the ER, make sure it's not a heart attack. We want to make sure that we rule that out first and foremost. And when it's not, then what ends up happening is you need to make sure that you find out exactly what else is going on there. So we get referrals from the ER all the time that say, go see Dr. Vidan, it sounds like you've got a rib out. So if you've ever heard that term before, rib out, it's a rib that's now out of position and causing pain in that area. So we want to get it back into position. People ask, does it hurt whenever you put it back into position? It's more like a, ooh, it stings for a minute, and then, oh, okay, now I can breathe. And usually that ends up taking, depending on the severity of what goes on with that rib head being out of position, it could take anywhere between 1 to 3 to possibly 5 adjustments before it stays and holds in that position so that now it's no longer a problem. If that's the situation that you're in, make sure that you find someone that can help you. Blake, I hope that this helped you, and I hope that you got the information that you needed and that you were looking for, but definitely find somebody that knows what they're doing as far as helping with these types of situations. Find someone that can get this taken care of. Make sure that you rule out anything as far as, is it something going on with my heart? And make sure that you try the other things too that Mayo Clinic suggested as far as decreasing the inflammation that's there too, because like we said, it's costochondritis, it's an inflammation. But it could be, if it's not just the inflammation, it could be the fact that there is a rib out of position that needs to be put back into position so that your body can do what it's supposed to do. Your body is meant to heal itself. But the problem is when things are out of position, it just can't heal as optimally as it can, or as that it should be, because it can't adapt to the way that it needs to be. So we need to get it in the right place so now it can adapt and heal and then get it all taken care of. Hey, I appreciated that question. So if any of you ever have any questions at all about anything, connect with me. Let's make sure that we connect, and I will be happy to answer any of those questions. I'm Dr. Alex Vidan. Hope that you found this valuable, and if anyone you know is dealing with any of this, please send it over to them.